Without formal systems. So the policy agenda for Ghana's how to transform the sub-district to group.
For your statements and the commitments that Ghana has made towards the success of the expected outcomes of this international meeting.
Utiliser aussi le modèle de télémédecine au niveau de la communauté. Vraiment, voilà un peu ce dont nous avons besoin au niveau de la Côte d'Ivoire. Merci beaucoup.
Merci beaucoup.
Du réseau du Ghana qui vont nous servir de modèle parce que en Côte d'Ivoire, nous avons évalué les structures de santé, mais nous n'avons pas pu évaluer les districts et les régions. Donc, on va s'approcher d'eux pour voir un peu l'outil qu'ils ont utilisé pour pouvoir évaluer les districts et les régions parce qu'au niveau de la Côte d'Ivoire, c'est l'outil d'évaluation de la qualité des soins que l'OMS a mis à notre disposition que nous avons utilisé jusque-là. Donc, on va s'approcher d'eux pour voir un peu ce qu'il faut faire.
Well, to do it. And we went down to the health facility level where, next slide, where we sit to interview the physician assistant to understand what they feel and what they want in the guidelines and how they feel that we should do it. So as I speak now, they are helping us to write our guidelines because what they do is what we are going to write.
And some of them which are like semi-private trust hospitals or missionary hospitals, these can also be looked at phase 1 and we need to see how then we move to the more formal private sector.
Just to illustrate how complex actually forming networks of care or networks in general may be. And so, as I think we all know, networks of care are a promising, innovative approach. And so in the next sessions, we'll have more time to discuss about how this approach supports service redesign, district health system strengthening for primary health care, and then more discussion in the group work over operationalizing and implementing networks of care and research agenda. Oh, sorry, there's a next slide.
It's about the values and norms at the sub-district level, which over time, our technical capacity has not been able to manage the cultural sensitivities of the sub-district level to deliver health. So we believe that the values and norms issue are going to be very critical.
It is actually an approach that we are using to strengthen our primary healthcare delivery. We have been practicing primary healthcare since 1971, and our primary healthcare system is the district level, the sub-district, and the community level. Over the years, we have been supporting our community level where we have the CHIPS compounds, and we've also been supporting the district hospital level. But it seems like we sort of forgot about the middle, that is the sub-district, where the health centers are located. So over time, we see that the health centers are not performing as we expect them to perform. And this is a challenge for us because we have a plan to achieve universal health coverage by the year 2030. By universal health coverage, we mean that everybody living in Ghana, in any of the regions, whether they are behind the river and you have to cross the river to get to them, or they are behind a mountain, they should be able to access health care when they need it. And they should not be impoverished by seeking health care. So that is what we are talking about when it comes to universal health coverage by the year 2030. And we believe that if we strengthen our primary health care, we should be able to reach everybody living within the space of Ghana with good quality healthcare services whenever they need it, without making them poor, without giving them catastrophic expenditure. When somebody is sick, they go to the hospital, and what they have to pay exceeds the household income. So that is what we do not want to do. And because we want to use primary health care to get to universal health coverage, we have to ensure that primary health care is solid on its feet. So the challenge or the weakness in our primary health care is the sub-district level, where the health health centers are located. And the health centers are also supposed to support the CHIPS compounds and other facilities at the community level. So this networks of practice approach is going to build relationships between health centers, CHIPS compounds, clinics, maternity homes, whether public or private, that operate at the sub-district level.
Earlier in the meeting. And so this approach that we call networks of care is a way of really strengthening the existing health system to improve the relationships and connections between different types of health workers as well as with the families and the communities to really improve the efficiency and functioning of the existing health system. So we really are optimistic that this innovative approach will really help accelerate progress to achieve the Sustainable Development Goals. So there are many examples from different places and different contexts where that show that there are innovative ways that you can improve communication as well as trust and linkages between both the community and the health system as well as between levels of the health system to improve how people and systems work together to really get the women and the babies that need the care to the care they need at the right time. And so that's how this whole approach will help support that. So I think it really builds on what's already in place. So it's not something new, but it's something to build on what already exists and to try to really strengthen how different providers work together. So say, for example, you have a woman come to a health center and she's having a postpartum hemorrhage, but she needs care. She needs to know where she can go at the right time. And so if she knows the health workers and trusts them, she knows which facility to go to. And if at that level of facility they cannot help her, then the providers will know where to take her in a quick, efficient way so that she can get the care that she needs. We know there are many countries, at least in the landscape review we did, we came up with about 30 different examples from 27 countries. But we know we're just scratching the surface. There's a lot more of this approach that's happening in other places, but sometimes it's called something different. Sometimes it's not out in the literature. So I think this meeting is really a way to start the conversation and talk to different people to learn more about where it is being practiced so we can systematically document and learn from each other. I don't know off the top of my head, but I know we will hear from colleagues from Senegal as well as from Zambia. We have colleagues here as well from Ethiopia and Cote d'Ivoire.
So those are the countries that are participating in today's program.
That's correct, yes, as well as our colleagues here from Ghana, yeah. As well as from other parts of the world as well. So we have colleagues from Indonesia, from Brazil, and Philippines. So it's not just on the African continent, but it's all over the world.
Your game changer in terms of identifying what local improvements you need to increase and to enhance, to improve the networks, whatever network.
Thank you very much.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.